Hello again. My name is Kelly Salinas. I'm 62 years old. I have ALS, but today was a good day. As we have promised, this is video number 4, and we will be talking about medications, and my wife will be explaining what got us to where we are now.
Hi, my name is April and I'm Kelly's wife, and we thought that in the interest of time, since there was so much to cover, that I would help him with the medications portion of these videos. We talked about this and we decided that at first we would talk to you just briefly about how Kelly's symptoms started, because we honestly didn't recognize it for what it was when it started. Kelly went for a birthday trip to Israel for 2 weeks. And while he was video messaging me, I noticed that his voice was starting to slur a little bit. So immediately upon getting home, we took him to our private doctor and had him have a cardiac screen to make sure he hadn't had a stroke or something, because this certainly wasn't like him. He was very athletic, he worked out all the time, he was very articulate, and slurring speech was definitely something to be concerned about. The doctor found nothing wrong with his heart. And so we went to another physician that was prescribing medications to him for some other issues and asked him about it. And he told us that he felt that those were just side effects from the medications that he was taking. So we didn't worry too much other than trying to get off whatever medication was causing the problems. Kelly's problems continued to get worse over the next year. He not only slurred his speech, but he had a little bit of trouble eating, swallowing. He would choke occasionally, and he would fall once in a while. His gait was altered. He started to stumble, and little by little, he started to drag his left leg just a little bit. It was your left leg, wasn't it, honey? Okay. It started to drag, and even people at work noticed about it. So thankfully, Kelly worked for a physician, a very wonderful man, who noticed the problems too and gave Kelly a referral to a neurologist. We went down to Chico, California and saw a wonderful neurologist. Do you think it would be okay to say his name?
Amen.
Thomas McKnight, a fabulous neurologist down there.
Nice man.
Yeah, a really good man who ran Kelly through every kind of test imaginable, excuse me.
He told us right away that ALS, MS, brain tumor, or possibly spinal cord injury. So we're gonna go through those. But he said, I doubt you have ALS because you don't have a twitch, okay?
Correct. So we were hopeful that it wasn't ALS. As a matter of fact, I told Kelly how relieved I was because I said I can handle anything else but that. So Kelly went through all the tests, and you probably know that ALS is a diagnosis of exclusion, which means that they test you for everything else and they kind of check those off the list. And when everything is marked off the list and all that's left is ALS, then they say that's what you have. So Kelly went through all these tests. We went back twice to see this doctor for additional tests. He had electrical current stimulation done, which was incredibly painful to watch. He said it didn't hurt very much, but it hurt me to watch it done to him. And then we went down in November of 2018. Yes. And November 9th of 2018. And this poor doctor came in the room and looked like he had the weight of the world on his shoulders. like that room was the last place in the world that he wanted to be. And he sat down and with a very heavy heart, he said, I think we have to consider ALS. And that was when our world changed.
My immediate thought was, well, okay, then now we know what we're dealing with. My wife got very emotional, and I think my brain kind of held back, thinking, well, he's gonna refer us to UCSF, so I'll kind of wait to hear what they say.
Well, we did get that referral to University of California at San Francisco, an amazing ALS specialty hospital that they have there at the University Hospital. And Kelly was able to see them on January 18th of 2019. The specialist there immediately said, yes, you have a moderately progressing ALS, and they confirmed the diagnosis from Dr. McKnight and Chico. And he saw several specialists that day, respiratory specialists, he saw physical therapists, he saw the physician, of course, we saw a social worker, we saw a speech therapist. We were there for probably 6 hours seeing different modalities and came home very overwhelmed. But what happened that day is we came home with 2 prescriptions of medication that Kelly was going to start. So we wanted to briefly talk to you about that today. One of the first medications was a drug called Riluzole, which has been around for, I think, about 20 years, that is supposed to help the respiratory symptoms of ALS. Many of the patients with ALS end up with difficulty breathing and end up on a ventilator. And so this was supposed to help maintain his pulmonary function. Kelly had a pulmonary function test that day, and what did you blow? An 88, 86, 83? What was it?
I didn't really understand the weight they put on the outcome of the test. So looking back on it, I don't think I gave it my all. They told me 80 to 100 is normal. I scored 82.
Okay. So we had that, and I'm a registered nurse, so I was quietly distraught at a score of 82 on his pulmonary function test. So we came home with this drug and also a prescription for Radicava, which is given intravenously. We had the choice of getting a PICC line, which is a peripherally inserted central catheter. It goes in the upper arm for him to get those medications through on the 10 days a month that he was supposed to be infused, or a port, which was installed in the right side of his chest. And we're going to show you right now a couple pictures showing what that looked like. Okay, we're smiling because we were making faces at each other while you were looking at those pictures. Anyway, Kelly came home. He started Radicava in February, 14 infusions the first month, and then 10 infusions in a row each month thereafter. He actually continued to slowly decline. His balance got worse. He was falling more. By June, Kelly couldn't roll over alone in bed. I was setting my alarm at night every couple hours to turn him so he didn't get bed sores. He couldn't get out of bed to go to the bathroom. In fact, in the morning when he woke up, he couldn't get out of bed by himself either, and I had to help him do that. So he was slowly declining. The end of July of 2019, this was 2019, Kathy Baldassaro, a woman that I met online in the ALS support group on Facebook, who lives back east, sent me a message and said, April, you have got to watch this movie on Amazon Prime called The Toxic Puzzle. So Kelly and I immediately turned on the TV and watched it. In fact, we watched it more than once. Both being in the medical field, we were fascinated with what the movie has to say, the documentary, and we encourage everyone who has ALS and caregivers of those with ALS to get this movie and watch it. It's free on Amazon Prime, and it's a very minimal cost if you don't have Prime. Kelly looked it up, and it was like $1 on one service. And
on YouTube, 99 cents. But if you already have Amazon Prime, it's free. Otherwise, $1.99.
Okay, there you go.
90 minutes long and worth it.
Yeah, it's a great documentary. So we watched that, and because of that movie, and we want to thank you, Kathy, for telling us about that because it truly changed our lives. Because of that documentary, Kelly started taking an amino acid called L-Serin. And right now we're going to pause just for a second so you can see a photograph of the product that we take, or that he takes. The product that was just shown to you on the video is available on Amazon. Kelly and I just kind of looked through the different suppliers of that particular amino acid, and we chose that one. So I want to add right here that we are not selling any product, we are not endorsing any particular product, and we are not being compensated for mentioning any particular product on these videos. These just happen to be the products that together we have researched and chosen for Kelly to use personally. So you'll need to make those decisions yourself. Kelly started out at 500 milligrams a day of the L-Serin supplement and now has increased up to 30,000 milligrams a day, which he takes in 3 divided doses. He takes 10,000 in the morning, he takes another 10 around the noon hour or shortly thereafter, and another 10,000 milligrams in the evening. After being on the L-Serin for just 2 months, we noticed a huge difference. The doctors will tell you that you do not improve with ALS. Nothing gets better. The best you can hope for is to slow the progression of the disease. And that's what we had hoped would happen with the Radicava. We did not, however, see those kind of results. What we did see 2 months into taking the L-Serin, that Kelly was now rolling over himself in bed without my assistance. He was slow, but he was doing it himself. He was also falling less, and his balance was better. He was choking less, and he went from getting part of it. Did you just blow on me? Oh yeah, I forgot to mention that he was able to kiss me again. He had got the ability to pucker again, which may not seem like a big deal to anybody else, but it was a big deal for us because we like to kiss.
And I couldn't even blow out one candle.
You can now, right? Yes. So we saw a huge change with the L-Serin. At the 2-month mark, which was in September after his September infusion of Radicava, Kelly made the decision to stop the Radicava and the Riluzole. And the only thing he's taking now are the amino acid supplements. We are by no way telling you to stop your Radicava or your Riluzole if that's what you're on. You have to make those decisions yourself after careful thought and discussion with your family, we would hope. For us, we just decided that we weren't seeing results with it, but we were seeing it with the L-Serin. Before we end this video, I want to add one more thing that we're taking because we are going to do a part 2 on the medications because there's so many different things. But the other supplement that Kelly takes is called Leap XX. You can read about this product online if you Google Manchester Project. So look up the Manchester Project. This product was used on ALS patients and it shows the results. We looked it up, we read about it, we saw that there was improvement with this as well, so we piggybacked it on top of his L-Sarin therapy. He takes a dose of this every single day. He does not drink it, he puts it through his gastric tube. That's something we'll talk about on a different video, but do take the time to look this up online and read about it, the Manchester Project. So is that all we wanted to talk about today, was the L-Sarin and then the Radicava and the Riluzole?
Yes, understand. We are not looking for miracles, but little positive changes are very celebrated by us. When I can roll over in bed, you may take that for granted. I don't anymore.
I want to add, I did mention that his balance was better. His ambulation was better too. In the end of July, we were packing to move to Idaho from California, and Kelly was unable to help because he couldn't walk. The most he could do was sit on the couch, and I would push boxes up to him and he would tape them and label them. Kelly now walks with a cane. He uses a walker on his weaker days, but he walks with a cane, and sometimes around the house he walks. We call it his wonky walk because he does kind of go like this, but he walks. In January, it was 1 year after he was formally diagnosed by UCSF, and that doctor had told me he would be in a wheelchair before the end of the year, and he isn't. And honestly, we both attribute that to the L-Sarin that he's taking and the improvements that he made with that.
And our faith.
We can't discount that, can we? God's been good to us. Yes. So we hope that this information has helped you, at least give you something to think about, something to read about. You can look up online the benefits of this therapy that other people have had and make a decision for yourself. And so we'll see you again on part 2 of medications. And until then, God bless you.